You are watching the DocTalk show.
Dr. Bide,
Yes.
Sobro,
Yes.
you have this client in your nutrition clinic.
Yes.
You've done all that you've done, and this patient is obese, whichever form of obesity they have.
Yeah.
How do you go about them? Do you also classify the overweight in this group?
Yes, of course.
Or they would benefit from this kind of management?
As long as someone is overweight, whether you're obese or overweight, the management is the same. But for someone, when someone is obese, it's not only nutritional, but there is also psychological, they have psychological stresses. So you have to make sure this person is psychologically okay. You have to give them the emotional support.
But will you be there for them?
Of course, I'm there for my patients. I call them, I motivate them. Yes.
Oh, motivate.
So it's
that's
important, you have to be there for them emotionally. Then the nutritional help comes in. Yes.
Because nutrition is a very big challenge. When people go to read information, this information is mainly written in
For the Europeans, for the
yes,
Western
they will
world.
tell them this, eat this pounds of food. Ironically, even the abbreviation of pounds does not reflect pounds. It's LBs, so
Yes.
people will not even
It's a bit
understand.
confusing.
And
They
so
need-
it has to be addressed in a local way.
Of course,
Yes.
of course. You have to,
And you know, it's a bit, you know, that the menus we have. For example, if you go for any typical wedding, or if you go to maybe a workplace, which food do they have?
They will have
Either rice,
matoke,
matoke,
rice,
posho, and some
posho.
chapati. If there's maybe there's cowpeas, and then there is guinness,
and that is what
and then
someone
meat.
is going to call
And
a
that is
balanced
our
diet.
usual. This is now Central Uganda. I don't know what's maybe in the north.
They will have variations when you
Yeah,
go to
so
the
you wonder
north or east,
which,
you'll have
how you're
kalo.
going to tell it to say that maybe you don't. If you tell them not to eat any of those ones, because I'm seeing so much rice, posho, carbohydrates already. Take them off, meaning people will be just drinking.
When you go to the west,
what
you'll
I
find
can
a lot
tell
of
you
proteins.
about diet, what matters in diet, they are the portions of the different food groups. Even if I'm dealing with a patient who is diabetic, whereby they have to watch their sugar consumption so much, there is nothing, I'm telling you, there is nothing that a person can't eat, but what matters is the portions.
How much you eat.
Yes,
So
how
meaning the
much?
body needs a balanced diet.
Yes.
We need the proteins, we need the carbohydrates, we need everything, but
Yes,
in quantities which are
acceptable.
So, bro, give me a schedule. Me, I'm here. Okay, my size, probably I would prefer to remain like this. What is my diet going to be?
Yeah,
I wake up in the morning, eat what? And how many times do I have to eat? In what amounts?
I
Roughly-
have not measured you. I do not know how much of the weight loss that or gain that you may need. But what I can tell you generally, someone has to eat a balanced diet and the portions. People need to know what balanced diet is. Because when you say balanced diet, someone thinks you put rice, this and all that. They
it's
think-
balanced. That is balanced.
No, someone can have like 5 different carbohydrates. You're like, why are you eating all that food? You're like, it's a balanced
So,
diet.
you know, it's a bit confusing. I always give myself as an example. There are times in the morning, you're in a diet program.
Yes,
Go in the morning. You know, most of our families, we have bread. That is the most accessible
yes.
for our families. So what is like a typical? You might not say that you have my program.
Yes.
But what is a typical, which is maybe a good breakfast? Well, like maybe average Ugandan family.
A good breakfast should have a carbohydrate. Never start a day without a carbohydrate.
Like
because,
example,
like-
anything, if I take a toast of bread,
like-
it's fine.
Just one toast of, even if it's white bread, but do not eat, people eat like 3 or 4 slices of bread.
butter?
With butter.
Both
So-
sides.
And then
Yes.
I'll add an egg.
Yeah, you have like an
And a
egg,
cup
but
of
if
milk
you're
too.
Egg
hypertensive
white?
and maybe you're diabetic, you do away with the egg yolk. You have an egg, you have a fruit. If you can have an avocado, because that is good fat. You make it a routine, you eat avocado, you eat an egg without the egg yolk, you eat a small slice of bread and tea. With
Tea.
either
Milk
honey
or
or
something.
very little sugar.
Milk is fine.
Milk
See,
is...
because some people are just addicted and want to take at least a cup of milk every day.
When it comes to milk, it depends on your maybe your medical condition. There are people who need calcium, they can have the milk.
My mother never takes black tea, but she's not obese, but for her, milk is her daily thing. So
She has no hypertension.
She's not hypertensive. So at the moment she's generally okay.
So she can take the milk as long as it's not every day and it is diluted when she's taking it, not taking full cream milk, or you can get her skimmed milk.
Okay, but generally speaking, our breakfast should have reasonable amounts of
every type of food.
Yes.
Now for an obese person, you should take around 20 to 100 grams.
So I want you to first tackle typically a person who is normal.
Who doesn't want to sleep to the other side.
Yes, who doesn't want to go the other side. Then we can treat this person.
A person who is normal.
Because I'm interested, okay, fine, we've looked at the breakfast. Then how many more meals should I have a day?
What you should know is eating small but frequent meals is better than eating few but
huge volumes.
Yes, someone eats breakfast at around 8. They have 3 slices of bread, a cup of milk, and that's it.
Then they'll go to office.
They will work throughout till lunch. Then they will have this huge plate of food with matoke, rice,
posho and chapati,
everything. Yes, and then they will wait for supper. But someone who eats, you eat 1 slice of bread, you take a cup of tea, you take an apple, small portions. Then don't wait for lunch. Between maybe 8 and 1, have maybe an apple, a fruit which has low sugars. You can have maybe an egg. Yes, you can have.
But of course, it depends. Sometimes the lifestyle. Sometimes to wait for lunch is not self-made, but a kind of work that you don't even that time to have to snack.
By the time you're trying to watch your diet, you already have a problem with the diet you what.
Okay, so what is this person? Give an option for the person in the village. You're talking about having an apple, eating an egg.
Yes, but
okay,
obesity,
what is the substitute for the person in the village?
Even another average Ugandan.
They have mangoes. They have fruits more than we do. And for people in villages, it's very rare to see cases of obesity. It's very rare.
Okay.
Yes.
So we have an obese person. We are trying to help them manage their diet. Because principally we mentioned diet as a very important aspect, as well as exercise or working out.
Yes.
So bro, you are saying, for example, if lunch comes, I can take all of the food I want, but in small, I say, a small piece of maybe matoke. Is it okay to put on also rice? Because as I'm looking at it, these are like carbohydrates.
There is something called, I use it with a diabetic patient, it's called a diabetic food plate portion. So on that plate, half of the plate has to have green leafy vegetables. Then a quarter of the plate should have a protein. Then a quarter should have the carbohydrates. And also consider carbohydrate counting. When you look at your plate, how many types of carbohydrates am I having? So it's better you have 1 carbohydrate per meal, but have a different carbohydrate on your next one to have diversity in the diet.
The problem, of course, the diversity is the accessibility.
Yes.
My friend,
and then most importantly, because we've mentioned or we've learned that when you're sleeping, you're inactive, so you're having lots of sugars converted into fats. There should be that space when the time I should have my dinner or whatever I'm going to have to the time I go to bed. Because some people eat and then they are knocked down and they sleep.
What I would advise people out there, for dinner, if you're not diabetic, if you're not on medication, why would you have a carbohydrate? Because I know Ugandans have late dinner. And
we have the best meal. We keep the meat for supper.
That is a challenge for us, especially the Baganda men. You must have dinner at home.
Yes, sit with your wife. You tell her, you know what, for dinner, I want to have maybe greens and maybe a piece of chicken or 2 pieces of beef.
You have modules for weight loss for different people?
There are different types of diets, yes. When I talk about the keto diet, it limits the carbohydrate consumption to 20 to 100 grams per day.
Yes, convince me. I'm huge. I want to cut weight. Tell me, should I still do my 4 meals but in small quantities? And then there's this thing of let me have 1 meal a day. What meal do I choose? Do I choose lunch or dinner?
I do not recommend skipping meals at all. You know, a diet has to be easy for someone who is getting one to eat. It's better you get on a diet which is almost similar to your former routine, but with healthier food choices. If you're obese, cut out the carbohydrate. Have 20 to 100 grams of carbohydrates every day. Then you can eat an unlimited amount of vegetables.
So you're saying 22, you said 22?
100. If you're obese, I would recommend.
Those are 2 pieces of Irish potatoes?
Yes. You have that in the morning, then the rest of the day you get energy from other, for example, a good fat like avocado. You can have a piece of chicken, you can eat fish, you can eat an unlimited amount of vegetables to keep you full. The reason why you're cutting out carbohydrates, it's because you want to make your body feel like you're in starvation, so that the body uses the stored fat to utilize it in producing
How do I
energy.
control that urge? In medicine, when you're starved or when you're hungry, the body is going to ask you to take more.
Yes.
Is there anything, like I've seen in smokers that the addicted ones, if they are weaning off smoking, once they feel the urge to smoke, they give them something.
There are those foods, especially fruits that have low sugars. It's not good to eat a lot of fruit when you're losing weight. People think, yes, fruit is good, I can take juice, but these fruits also have a lot of sugars combined. So when you take like a full watermelon, there is no work you're doing because it's a fruit.
I thought I'm doing something.
No, there is
Full
no
of
work.
water.
So if you feel hungry, you can grab an apple. It's a good fruit. It has low sugars. The physiology of the body, there's a way the body is. If it needs energy and you already have stored fat, the
adrenaline is going to help me convert the fats into.
Yes,
but Subra, before we wind up, I need you to tell that person, we've not talked about exercise.
Yes.
Am I just going to hit the road and start running? Am I going to go to the gym and carry stuff? And
not really, but the minimum amount of days someone can exercise is 3 days per week, and at least past 30 minutes into the exercise. You can decide to walk, but the walking also matters, because if you move sluggishly...
What's for us now, the work we do, we walk. I don't know if you are doing exercises, we are walking around.
Yes, the people who do sports science, they can explain better, but I know the exercise has to be over 30 minutes and it should be at least vigorous.
Okay, then, when we come back, we're going to have a successful testimony, feature story, with someone who has successfully managed to cut weight.
You are watching the DocTalk Show.